Well, parents and caregivers can now begin applying to the Canada Revenue Agency to receive the new federal children's dental benefit. So to talk more about this, we're joined live by the Ontario Dental Association President, Dr. Lisa Bentley. Dr. Bentley, good to chat with you this afternoon. I understand you like the program, but you have a lot of questions still about the implementation and who's actually going to be benefiting from this.
Well, the Ontario Dental Association is really excited. We're always happy when government recognizes that oral health care is a really important part of overall health, and they're willing to invest in oral care. So it's a good day today.
What are your concerns, though? I understand that your dental clients, customers, patients, etc., kind of are a bit confused about how they may benefit. Some may even be canceling their benefits because if you, according to the plan, if you make less than $90,000 a year combined in a family, you are potentially eligible for this. So why pay for insurance if you might be getting this? But that could be a concern.
It is a concern that people have the misconception that dentistry is going to be free in Canada in a couple of years. That's not going to be the case. We're really hoping that this plan focuses on the 30% of Canadians that don't have access to dental coverage. While 70% of people do have access to amazing dental coverage through their third-party plans. And these plans focus on prevention and keeping patients healthy.
So, Dr. Bentley, I understand that you've run some numbers, and you're also it sounds like the ODA is concerned about how much of a benefit people may actually get from this. My understanding is, top line, it's supposed to be sort of $650 a year.
Well, $650 a year for children under 12 is a good number. And I think that the Dentists of Ontario would agree that we can really help maintain children under 12's health with that sort of a budget.
But I understand here that you are, in your press release here, it says you think it could work out to $200 in coverage each year. How have you come up with that number?
Well, that's if all of the people who are eligible for the plan were to lose their third-party coverage. Then if that's the case, then it would work out to be less than $200 per household per year, and that's not sustainable.
Got it. Okay. So Dr. Bentley, what do you need to hear from, I suppose, the federal government to sort of get some clarity around this, not only to help dentists out, but also to help people who may be eligible out?
Well, the federal government has been quite clear that people who are eligible for the program can go online and apply. And so we're pretty satisfied with the federal government. We want to continue working with them to ensure that the future benefit plans that they implement we've had some input on those. Our big concern is with the provincial dental plans. There's 5 provincial dental plans in Ontario, and they're all chronically underfunded. And those are the plans that we have our biggest concern with. And we've been asking governments for 15 years to look at these plans. They have been not looked at or touched in 15 years. And they're chronically underfunded, and they're not meeting the needs of those people on those plans.
So is there any potential overlap here that the federal program may overlap some of these provincial? Is that the question, or is it just the fact that the provincial side of the equation here appears to be underfunded?
The provincial side of the equation is critically underfunded. So the most recent plan that the provincial government released was the Ontario Seniors Plan. And those patients, that plan is failing those patients. The patients have up to a 2-year waiting list on that plan. They had to leave dental offices that they were comfortable with and attend public health clinics. And only 20% of the eligible seniors have actually received care under that plan. It's just not, it's not sustainable.
I'm going to assume you've taken these concerns to the provincial government, whether it's the health minister or finance minister, et cetera. What has the provincial government response been to that?
Well, we recently had a lobby day at Queen's Park, and I had the ability to sit down with Sylvia Jones and express our concerns, and she is well aware. I'm actually a constituent of Sylvia's, and I've visited her for over a decade and expressed the concerns that we have with the provincial plans.
Right. I mean, just in general, Dr. Bentley, when you think about dental health, some people just about, think it's just about cleaning your teeth, but it's about much more than that. This is why this is such an important conversation, isn't it?
That's exactly correct. It's about prevention and finding small problems and fixing them before they become big problems, and prevention to prevent gum disease, which can impact your overall health.
Right. I mean, sort of your health sort of begins with your mouth, right? I mean, what you put in it, what happens inside your mouth can have a huge impact on effectively the rest of your body.
That's exactly right. That's why it's so important not to delay treatment and to really focus on prevention and seeing your dentist regularly.
All right, great conversation this afternoon. We'll see if we can get some clarity in the coming days. Ontario Dental Association President Dr. Lisa Bentley, appreciate the time. Thank you.
Thank you so much.